So, how do we create cross industry collaboration to solve this important issue?
I'm going to let you
Sounds
go
like
first because this is a hard question.
well, I think it is absolutely important that we recognize this question, this issue, as a whole society issue, right? It's, health equity, health outcomes, like I said, is only 20% of it that happens when the patient walks through the door.
Yeah.
So patients having access to health insurance requires them to have a job for the most part in this country. That's the way our health system has been built. So part of the intervention is making sure that we're putting, investment back into the community. So for example, at our organization, we focus on supplier diversity. We're spending millions of dollars on all kinds of contractors. How do we make sure we're serving the community? And some of those contractors are from our community, because if you do that, then they get health insurance, then they have access to health care, and you've started to whittle down some of the barriers. And if I think one of the things mentioned earlier was transportation. If you have a family who has to take 3 buses to get to you, can you partner with a transportation organization to get them to their appointment? So, because if you can't get them there, then the clinicians are sitting there going, this patient is non-compliant. While the poor patient is trying to take the day off work, get their kids home, take a bus, a train, and an automobile to get to you. Can you solve for some of those so that you can get the patient there? I can't as a clinician, but we have partners in the community who can do that. And so as we're going out, cross industry participation is critical. I'll just give you an example of what we did with the COVID vaccine. When the vaccine came out, I live in the land of Amazon and Microsoft. Therefore, everything is super sexy and techy, right? So all the appointments were on a link where you had to refresh and keep searching until you found one. So if English was not your first language, or if you didn't have a teenager in your house like I do, those links could be pretty challenging, right? So we had to think about, how do we get these vaccines to the communities who are disproportionately affected by this virus, right? So we looked and we got partners who gave us Wi-Fi, who gave us, because T-Mobile lives here, so they gave us Wi-Fi, and we were able to go out and give records. Other partners gave us trucks, gave us, workforce. People, our partners across the industry brought the things we needed to allow us to go out into the community, where we partnered with churches, with the YMCA, and say, hey, these populations, we'd like to be able to get to them. So those kind of partnerships are things that we could not do alone as physicians, or as a health system. And so, so some of the work that Wildflower is doing, which I will let Dr. Parikh speak to more, is exactly the kind of thing we're doing. Because as I'm talking to doctors, they look at me like, "Are you serious? I have 5 minutes to see this patient. You want me to do what?" And so, so being able to have partners who can make it easier for them to do the right thing, right? Give them the information in a phone where we have to be anyway. Give them a platform where they can connect with their patients and be able to do what they intend to do, right? We went into healthcare to help people, but we're trying to manage time and all sorts of other priorities. So having partners who can say, okay, I'll get you an app for that. I think there was a commercial that said that a few years ago. There's an app for that. I will get you something to help you to bridge those gaps, to collect information, to help the family have connection with you, is really important. And the last one I'd like to talk about is the importance of congruency for clinicians and patients, right? Having a diverse clinical workforce is very important to be able to serve a diverse population. Because if I, as an African American woman, walk into the clinic and I see an African American woman, there's a whole lot that I don't have to explain, right? I can say hello and just go right into it, right? But when I'm dealing with people who are not familiar with my background, with why my hair looks like it is, there's a whole lot that we have to break down before we even get to taking care of one another, right? So, but in our country, the minority population are minority for a reason. So you're not going to get to the point where you have one-to-one matches, even though data has shown that when you have congruency between clinician and patient, the outcomes are better. But when you have a more diverse workforce, the rest of the workforce that are the majority and that are not necessarily minority start to understand and build cultural humility. They start to understand that there's value in people from different backgrounds. So one of the things we've done in the space where I am, where we didn't have a really diverse workforce, we build partnerships with schools who can bring those workforces to bear with us. So we built a partnership with a historically Black college called Meharry, where we can bring African American minority clinicians to come do rotations with us. In so doing, introduce them to our system in the hope that over time they will want to become part of our medical staff. And in so doing, begin to diversify the workforce. Because when my colleagues start to meet people like me, when they first met me, they were like, they had lots of questions. But as we get to know each other, they realize that I have a different perspective on life, but my perspective has value because now they know me. And so when they see other people like me, they're like, oh, yeah, I have somebody who did X, Y, and Z. So it starts to make the ecosystem more friendly, less daunting for people who are minorities.
Yeah, and just I'm going to go back to something Dr. Onyoko said when she first started just answering this question, the whole 20% rule. One of the best ways to improve pregnancy outcomes is to have a patient enter pregnancy healthier. And one of the biggest problems that we have is that the groups that experience disparities in outcomes are disadvantaged to begin with, right? They come into a pregnancy at a clinical disadvantage in addition to a socio-demographic disadvantage, or a clinical disadvantage driven by a socio-demographic disadvantage. And there's a lot of different reasons to that. Not necessarily the goals for this conversation, but if we take a look at our healthcare system and the way that it's designed, there's not really an emphasis on preventative care. I know there's a lot of conversation about it today. There's a new emphasis on making sure that people are able to receive preventative care, but it's really, in the grand scheme of things, a nascent conversation and drives you all the way back to the beginning, which is how do you provide a baseline level of healthcare that is a right for all people, and make sure that that care is delivered equitably. And it starts with really the payers in this country, regardless of whether we're talking about the commercial population or a population that's serviced by government programs, Medicaid and Medicare, having them reevaluate like how we actually assess risk and deploy services to these patients, so that we're thinking about more than just the 1 year time frame, and really paying for the things that keep patients healthier earlier. And so we need to really transition in the US from a system of reactive medicine to preventative medicine, for lack of a better way to put it, right? And so I think, as we're talking about this, the programs that we can put in place as a health system and the programs that we can put in place as an enabler, by bringing technology and services to the table, we can have impact together, but that impact doesn't nearly take us as far as we need to go. And so it's super important to keep the conversation going at a system level to drive the changes so that women are entering pregnancy healthier while we're fixing the things that we can have control over when they're actually pregnant.